As patients transition from one care setting to another, it can be difficult for providers to stay up to date with their health information. Much time is spent making phone calls to locate missing information. Waiting hours for other providers to fax reports is frustrating. If the information doesn't arrive until after the patient's appointment, it may be of little value. There's a new way to access information that's needed to provide safe and effective care. With the VITLAccess provider portal and a patient's consent, clinical data available on the Vermont Health Information Exchange can be viewed immediately. More than 130 healthcare organizations are providing data, including Fletcher Allen Healthcare and Dartmouth Hitchcock Medical Center. Providers can view patient demographics, lab test results, clinical summaries, radiology reports, transcribed reports such as hospital discharge summaries and emergency department reports, and pathology reports.
It makes things go much smoother in the office. We can get lab results much quicker than before when we had to call the facility, and it sometimes would take an hour or so to get results. Now we can get them immediately. So it really helps workflow.
I think the biggest benefit is being able to get a better picture of where a patient has been and making it more efficient to direct future care and to discuss what's been going on with a patient right then, right now, without having to wait.
VITLAccess also provides information on patient medications from nationwide sources. These include pharmacy benefit managers, pharmacies, and insurance plans. A robust medication history that includes fill dates and compliance notices helps providers spot potential medication interaction problems.
People are in the emergency room because there's something that's not going right, and so you have to make some sort of change. And being able to understand all the medications that someone has been on before, and being able to figure out if they've actually been compliant with those medications, all of that's critically important, and that's information that we can get easily out of VITL.
VITLAccess has been really important to us because parents aren't always able to give a good history about their child. So for example, kids will sometimes go to the emergency room with their parents because they're ill and they'll be put on medicine, but the parents won't understand what the medicines were or what happened in the emergency room. And so it's very helpful for us to be able to look at VITLAccess to find out exactly what did happen when they were seen and what medicines they were put on.
Patients must give consent for their information to be viewed with VITLAccess. Once granted, consent allows all treating providers access to a patient's information.
Most patients were very happy to give consent to VITL, for us to look at VITL. Most people really felt that it would only help their care if we had information.
In today's world where patients often receive care in multiple settings, VITLAccess is the tool providers need to track care and build a more complete patient history.
VITLAccess gives you additional information on your patient that you may not have. It adds to the history, augments it, and fleshes it out in a way that you may not get from any other source. And that information is incredibly valuable when it comes to actually treating your patient.